South Africans are wondering what President Cyril Ramaphosa will say this evening. The Health Department Deputy Director General, Dr. Anban Pillay, joins me now to give us a sense of what he is expecting. And Dr. Pillay, I want to quote this uncanny quote from you. This came from you in August, right? You were saying, we are quite concerned because in most of the countries that have already experienced this, you would have noted that when they move to a lower level of lockdown, people understood that the virus is gone and misunderstood it and went out and partied. Within 2 or 3 weeks, they had to reinstate many of these measures in order. That was uncanny, and you said this in August. Do you believe we are at the point you were predicting in August?
Yes, I think unfortunately those predictions have come through in many ways. I think we're at a point now where we're in the surge of the second wave as such, and I think we need to take measures to basically stop that from getting as bad as we did in the first round.
What does take steps to stop it from getting as bad as it did in the first wave? What does that look like in your thinking, in your own thinking, but also departmentally?
I think we need to identify what are the biggest drivers of this type of transmission and how can we stop it. And very clearly the biggest driver is gatherings, particularly at this time of the year where people are keen on having parties during the festive season, alcohol use, and those two combined usually result in people forgetting about using a mask, about distancing, etc., and we have high levels of transmission. We saw that in the case of the Rage Festival. We saw that previously in the Tin Roof Party, etc. So there have been a number of those kinds of incidents that have, I think, given us clear pointers that this is probably the place that we need to intervene most urgently on in order to prevent further transmission. Obviously, the messaging around masks, around social distancing, hand sanitization, etc., continue to be as important as ever, because this would be the most important prevention measure that we can use against getting COVID.
So without asking you to preempt what the president will say, I'm reading from what you are saying that no one should be surprised, really, if, and that's a big if the announcement from the president later on is that there'll be a curtailing of some of these activities, particularly around gatherings.
We'd be hoping for that because I think that has been the biggest driver thus far across several provinces, whether you look at the Eastern Cape or the Western Cape or KZN, and I think it's only a matter of time whether Gauteng has a similar type of experience. Yeah.
And then talk to me about the state of readiness of the health system, Dr. Pillay, because at the start of the epidemic in South Africa, we put a lot of emphasis and focus in ensuring that, we have enough hospital beds, and we were talking about such things as oxygen flow. We had emergency hospitals that were constructed, and isolation units and ICU wards, etc. It seems over the month we got to a sense that we were not really needing those as much as we had initially predicted. What is your calculation as a department going into the second wave? Are we likely to need this more and more? And is the demand likely to be higher? And are we able to meet that demand?
I'm hoping, obviously, that we don't need them more and more. So that's why we would really propose that we implement these measures. But if we do need them, we obviously do have them in the form of ventilators, in the form of ICU beds, etc., and oxygen and the like, as well as the drugs that are required. But we really don't want to get there. So our measure is largely around trying to prevent those numbers from getting to that level. A bit like the point you made earlier about condoms. We don't want to be talking about giving people antiretrovirals. We want to talk about them using condoms so they don't get HIV.
And what about inter-provincial travel, Dr. Pillay? That's the other aspect that we're not touching on. When you look at the numbers, there are certain provinces that, at least at this particular point, seem to be, far advanced in as far as the second wave is concerned compared to other provinces that are sort of, lagging just behind. Are we likely to see a proposal being made for inter-provincial travel to be somewhat restricted?
I don't know what the decision is going to be on interprovincial travel, but certainly if it is allowed, I think people need to be very cautious about wanting to move around. I would certainly not be wanting to move around during this period, largely because I think that there is lots of gatherings and mingling during this time, and you have people from high-risk areas mingling with people from lower-risk areas, and so it's not as if you currently know where the high-risk people will be based, so you can avoid that. It's going to be quite a risky situation. So I would discourage people from moving around if they're going to be allowed to have interprovincial travel.
And what is your sense of whether or not an alcohol ban could potentially be needed? And I'm not asking you to preempt, of course, what the president will say, but talking about the need to have as much hospital bed space as open as possible, which was part of the rationale that was advanced a bit earlier on when we had the ban in place, to say that, you know, we're trying to keep the hospital beds open because the consumption of alcohol, irresponsible consumption of alcohol, does lead to incidents, and issues such as the curfew were also justified along those lines. Does that rationale still apply, and is it even more heightened at this particular point as we enter the second wave?
Well, you know, speaking to me as a public health person, my response is obviously going to be alcohol and cigarettes should actually be banned because they do more harm to the health system than any benefit. But if you talk to my colleagues in the economic and finance sector, they will tell you that alcohol and cigarettes make great contributions to the tax system, and there are many people who responsibly use alcohol, for example. So I think the balance will have to be achieved between those two things. But certainly, I think some level of restriction around access to alcohol will certainly help us in terms of hospital beds. My colleagues in all of the provinces are really crying out, saying the alcohol plus COVID is really putting a huge strain on beds and on them as well, because they're working very hard currently, long hours, to deal with this.
And finally, Dr. Pillay, let me ask you to wade into this controversy. You will have heard the Chief Justice rendering a prayer at a particular function that he was attending. No one has any quibbles with his right to believe his religious convictions. I don't think anyone has any quibbles with that. But the content of the prayer itself has been analyzed at length, particularly in as far as he was saying that if the COVID-19 vaccine is of, quote, 666 and going to tamper with the DNA of South Africans, basically it should not succeed. As a public health specialist, your sense about the importance of messaging around vaccines, particularly by holders of constitutional offices?
Yes, I was quite concerned when I heard that message, simply because on the issue about tampering with the DNA and genetic material, I think it's important to make the point that there are a number of medical interventions that have been implemented over the years that do tamper with the DNA in order to be able to change the course of a disease for humans. So this is certainly not the first time that medical science will be intervening in this way in order to amend a genetic process in order to support fighting a disease. Having said that, I do need to also say that not all of the vaccines are linked to some sort of genetic modification. Only two of them, the vaccine produced by Pfizer and the vaccine produced by Moderna, are produced through what is referred to as an mRNA process. The others use the traditional methods of producing vaccines, which are a bit different. So I think to put all of them into the same category would be scientifically incorrect. But even those that are being produced through the mRNA process, remember they are assessed through a very stringent regulatory process of assessing the risks and benefits and harms before they're released into the public. And even when the public does receive them, there is massive vigilance around whether people are having any adverse events. And if they are, then the regulator will step in and amend the way the product is being used. South Africa will probably get access to the vaccines after they've been quite widely used in the US and in many countries in Europe, We're expecting them in Q2. By that time, thousands, if not millions of people would have accessed the vaccine. So if there were any adverse events, we would be hearing about them early on at this stage before we actually receive them.
All right, Dr. Anban Pillay, thank you for your time and for sharing your views there on that particular issue that has to do with the Chief Justice and his prayer a few days ago.